Accelerated nursing program is one of the most challenging academic journey out there. Now imagine trying to understand in 14 months or even less what would usually take 3 to 4 years to learn. Now that's the reality. Students don't usually fail because they are not smart enough. It is because they don't have the soft skills, that everyday skills that keeps you focused, organized, and resilient even when it gets tougher. Hello guys, welcome back to my channel. My name is Winnie, and on this platform I share my experience as an international student in the United Kingdom. If you haven't subscribed to my channel yet, please click on the subscribe button, but don't stop there. Like, share, and comment, and I'll be right back. So in this video, I'm going to be sharing the soft skills that are needed to do well in nursing school. Now, it doesn't matter what part of the world you are, USA, Philippines, Canada, Nigeria, Ghana, United Kingdom, name it, Australia. This video is going to help. I hope it does, hopefully. Now, let's start with time management, because in accelerated nursing program, time management is your currency, everyday currency. Here's the situation. A week in nursing school usually feels like months squeezed into 7 days. You've got clinicals, you've got theory, you've got assignments, you've got presentations, you've got essays, you've got quizzes. There's always something to do in nursing school. And that's why you need to be able to prioritize and manage your time effectively. But how do you do this? Firstly, use a calendar. I know you'll be thinking, oh, I've got to do a to-do list. But just writing down tasks without scheduling them into time slots will not be effective, in my opinion. So write down the tasks, but don't stop there. Schedule into time slots for each day what you should be doing at what time, and that helps you stay organized. Number 2, have your nursing priorities. Like I said earlier, there's always a million and one things to do. So know your deadlines and prioritize based on deadlines. What assignment needs to go in first? Start with that. What quiz needs to go in first? Start with them. And make sure that you add in buffer time, because what if that task that you slotted in an hour for takes you more than 1 hour? So adding extra time to give you that soft landing, that cushion effect, so you're not feeling stressed or anxious at the end of the day and even go under pressure. Adaptability. Nursing school is so unpredictable. 1 minute you're having clinicals in the allocated time slot, the next minute things are changing around. That class can be rescheduled, that assignment can be rescheduled, that test can be rescheduled, that placement can be rescheduled. So you need to be able to adapt to situations as they arise as a nursing student. So instead of panicking when things change, think, what can I do now? What are my next steps? What is the best thing to do to fix the situation or to adapt to the situation? No panics. Accept imperfection. All right? Adaptability means that you have to accept imperfection. Now, when I say imperfection, I do not mean that you are not perfect or there's something wrong somewhere. No, it means accepting that things might not go exactly the way you've planned them to go in your head. Things could change, so be able to adapt to change as it arises. But accepting that reality is one way to adapt quicker. In nursing, communication can literally save lives. But let's bring it down to the classroom. You need communication to be able to make progress as a good student nurse. Know when to ask questions, know how to ask questions. Don't be quiet in class. You do not understand anything. Be clear, be polite, and pass your information, okay? Ask questions. That is practicing communication skills. In clinicals or placement, communication is equally important. You need to communicate with patients, communicate with family, nurses, doctors, and the entire multidisciplinary team. Now, one way to make this easy is practice communicating slowly in a simple way. Now, be mindful of accent. A lot of people might not be able to pick on your accent or understand what you're saying. But if you go slow and clear, they would be able to understand you. And when you're relating with patients, always try to communicate in a way that they can understand. Think about what the best way is to communicate with them. Do you need to communicate? Can they hear you when you talk? Do you need to use to write it down? Do you need to go louder? Do you need to speak slowly so that they can read your lips? Just be thinking, how best can I communicate this? But always go simple. Simple does it. How do you handle pressure? Accelerated nursing is like a marathon, but it's not the one that you take your time and you're gravitating towards the goalpost. You're walking slowly, not that one. It is marathon, but with sprint speed. So you're going on a long journey, but you're going very fast. So how do you handle pressure? No doubt you will feel overwhelmed sometimes. I did. You will feel pressured sometimes. I did. But what makes you stand out is how best you can manage this. But hold on, hold on. I'm here to share some tips. I practice self affirmation. So instead of saying, I can't do this, I tell myself, Winnie, you can do this. Winnie, you are doing this. Winnie, there is always a way. Winnie, it can only get better. Winnie, you are making progress. Winnie, one step at a time. Winnie, you are moving forward. Self affirmation. Number two, I celebrate small wins. I did it. Baby steps. Woo! I'm excited. I did it. I'm excited. Oh, you've done well. Well done, Winnie. You're doing well. You're making progress. Celebrate small wins. Critical thinking. Exams are there to test you, not just what you can memorize, but how you can apply knowledge into practice. So there goes your critical thinking. How well can you think like a nurse? But you are a student nurse. It starts with always asking why. Why am I doing this? Why is it important? Why do I go with step one before two? Questioning things and not accepting them at face value. You are studying about a disease condition. Why does this disease condition exist? Link the subjects together. Don't study pharmacology separately from pathophysiology. Do not study it separately. Link them all together. You're thinking about a disease. What is the pathophysiology of this disease? How does it present? What leads to what? How is it treated? What are the nursing interventions? What is the nursing education? Link it up. That is critical thinking. Always questioning. Why am I doing this? How best do you work together? Are you a loner or do you work well in a team? Teamwork, team spirit. In nursing school, you might have come across some group assignments. You've got to work together, but it goes beyond the group assignments you come across in nursing school. When you become a nurse, when you work in a healthcare setting, when you're on clinical placement, you've got a vast number of people to work with. Different specialty. They won't all be nurses. There's the doctor, there's the patient, there's the family, there's the relative, there's the carer, there's the physiotherapist, the nutritionist, dietitian, podiatry. There's a lot of people that you've got to work with. All right. So learning how to work in a team, very important. How do you do this? Start by sharing the knowledge you have. Have you come across a very good resource? Share with your colleagues, share with your classmates, your course-mates. Share that knowledge. Are you good in an area? Share that knowledge with someone. Support each other. Finally, self discipline. Now, this is that invincible thread that keeps you going when you're stressed, when you're tired, when you lack motivation. This keeps you going. Some days you feel inspired, but some days you just lack motivation. You just want to lie in your bed, cover yourself under the duvet, and not get out of bed that day. But self discipline is what makes you get up, get dressed, and go for your clinicals. Get up, get dressed, and go for your lecture. Get up and do your assignment. That's self discipline at work. How do you develop this? Practice routines. Have a routine, something that works. Keep trying routines until you find something that sticks and works best with you. Do you find it easier studying early in the morning? Stick to that routine. Do you study better, assimilate better at night? Stick to that routine. Number two, find an accountability buddy, somebody who can hold you accountable. It might be a friend, a classmate, might not necessarily be a nursing student, someone who can hold you accountable, someone that can ring you on the phone. You said you were going to be doing your assignment now. What are you doing? Get up, get up, get up. Go and do your assignment. Oh, how far with that project you mentioned to me? How far have you gone? Get on with it. Get on with it. That is an accountability buddy or partner. Get an accountability partner. It can help you stay disciplined and motivated on the days where you lack that inspiration to just go on. Number three, eliminate distractions. Are you studying? Put your phone notifications on silent. Anything that would distract you. Look for a quiet place if you like studying when it's quiet. Just find what works well with you, but try as much as you can to eliminate distractions so that you can stay focused. Now that's all for now. If this video helped you, please hit the subscribe button. Please like, please share, and please comment. And know that when you like, it goes a long way to say that the video is good value, okay? And it can gain a wider reach to support more students, okay? So do not stop at subscribing. Go beyond that and click on the like buttons, please. And don't stop there. Share. And do you have any questions or perhaps any tips that have helped you excel well in nursing school? Please leave them in the comment section and I will be reading. And until we meet again, guys, keep winning and enjoying life. And bye.